Welcome everyone. In this session, you will learn about the muscles of the anterior compartment of arm. The anterior compartment of arm has three muscles. One is coracobrachialis, second is biceps brachii, and third one is brachialis. These muscles are supplied by musculocutaneous nerve. Coming to the first muscle, coracobrachialis. It is a small muscle that morphologically represents the medial compartment of arm. What is the origin of coracobrachialis? Coracobrachialis originates from the tip of coracoid process of the scapula along with short head of biceps brachii. What is the insertion of coracobrachialis? Coracobrachialis inserts at middle 5 cm of medial border of humerus. Coracobrachialis is supplied by the musculocutaneous nerve. What are the actions of coracobrachialis? Coracobrachialis is flexor and adductor of arm. What are the peculiarities of coracobrachialis? The coracobrachialis muscle is pierced by musculocutaneous nerve. Morphologically, coracobrachialis muscle has two heads and a musculocutaneous nerve passes through these two heads. Coracobrachialis is also called concise perforated muscle as it is pierced by musculocutaneous nerve. What is the ligament of Struthus? It is occasionally present. It extends from trochlear spine to the medial epicondyle of humerus. Coming to the second muscle, biceps brachii. In the exam, you may get a question as write a short note on biceps brachii. You may also get a question as write a short note on bicipital aponeurosis. What is the origin of biceps brachii? The biceps brachii muscle arises by two heads. A long head originates from supraglenoid tubercle of scapula, and a short head originates from tip of coracoid process of scapula. What is the insertion? Biceps brachii inserts through its aponeurosis and the tendon. Tendon inserts on the posterior part of radial tuberosity. Bicipital aponeurosis extends on the medial side to the ulna and merges with the deep fascia of forearm. What is its nerve supply? The biceps brachii is supplied by the musculocutaneous nerve. What are its actions? The biceps brachii produces supination of flexed elbow that helps in screwing action. It can produce flexion at elbow joint. This is its strong action. It can also produce weak flexion at shoulder joint. Its long head prevents upward displacement of shoulder joint. Can we test this muscle clinically? Yes. Ask the patient to flex the elbow against the resistance in supinated forearm position and palpate the contracted muscle. Coming to the third muscle, brachialis. In the exam, you may get a question as write a short note on brachialis. What is the origin of brachialis? It originates from the lower half of anteromedial and anterolateral surfaces of humerus, and also from anterior surfaces of medial and lateral intermuscular septa. What is the insertion of brachialis? It inserts on the anterior surface of coronoid process and ulnar tuberosity of the ulna. What is its nerve supply? The musculocutaneous nerve supplies medial and maximum part of the muscle. There is one interesting fact that the radial nerve supplies small lateral part. Earlier, it used to be considered as radial nerve carries proprioception from brachialis muscle. Why brachialis is called workhorse of the elbow joint? Because brachialis is a strong flexor of the elbow joint. Can we test this muscle clinically? Yes. Ask the patient to flex the elbow against the resistance and palpate the contracted muscle. That's all regarding the muscles of anterior compartment of arm.